Hello everyone and welcome to my channel. My name is Maria, and in this video I'm going to be sharing 5 things that I believe newly qualified nurses should do at the start of every shift. I feel like this video is going to be really helpful for people who just want a bit more of kind of like an insight into what nurses actually do, and I also feel like this video is going to be really helpful for newly qualified nurses who are not sure how to kind of like initiate and start, you know, their nursing role. You see, when you actually become a nurse, it's like you're not a student nurse anymore. You can't just wait for your mentor to tell you what to do. You actually need to kind of start. So I feel like this video will be really helpful for you guys. Obviously, where you work is going to be different. Your patient's condition is going to kind of determine, or it's definitely going to determine what you do and don't do. Just to give you guys a bit of a background, I'm a registered nurse, band 5 registered nurse. I'm working on a cardiology ward, and I do split my time between inpatients and outpatients. And the 5 things that I believe newly qualified nurses should do at the start of their shift is going to be based on my role, what I do when I'm working as an inpatient nurse, and that's primarily with level 0 and level 1 patients. You know, the nursing role is very varied. If you're working in ICU in comparison to working in a GP practice, what you do at the start of every shift is going to be different. But like I said, I'm just going to base it on what I currently do and things that I found to be very helpful when I was starting out in the nursing role. The first thing that newly qualified nurses should do at the start of every shift, whether it's a night shift, a day shift, a late shift, is to make sure you introduce yourself to your patients. I know this sounds very basic, but recently there was a whole campaign saying, "Hello, my name is." I'm sure a lot of you guys have heard about this, and if there was never an issue of, you know, healthcare staff not introducing themselves, then the whole "Hello, my name is" campaign would never have been a thing. So make sure you introduce yourself to every single patient. Not only does it allow you to do like a quick visual assessment of who they are, it also allows them to know, okay, I know for the next 8 hours, I know for the next 12 hours, this is the nurse who is going to be looking after me. So let's just say at the beginning of the day, I've got 6 patients in one bay. I'll go into the bay, I'll say hello to the patient in bed 1, bed 2, bed 3, all the way round to bed 6. Even if it's a patient that I've cared for the past 3 weeks, I always make sure I introduce myself to them. Just a very quick example of how I'd introduce myself to a patient. I just go to their bay, stand at the front where they can see me clearly, just say, "Hello, my name is Maria. I'm one of the main nurses that will be looking after you today. I'm also working with a healthcare assistant. Her name is Christina." And yes, that's just a very quick basic introduction. And obviously you might ask the patient if they've slept well, how they're feeling, just general quick questions just to make them feel a bit more comfortable. And the reason why I always introduce myself as the main nurse is because sometimes I may have to escort a patient to a different hospital, I may have to escort a patient to a different ward. Sometimes I'll be away from my bay of patients for a prolonged period of time, and I don't want my patients to ever feel that just because I'm not there doesn't mean they can't ask other nurses for help, especially when it comes to very basic nursing duties. For example, if they need help to get to the toilet, if there's something wrong with their cannula, if I don't know, they need help cutting up their food. I don't want them to feel that, oh, if Maria's not there, if, you know, the healthcare assistant Christina's not there, then they've just got to sit there and kind of like suffer in silence. That's why I make a point to say that I'm the main nurse looking after them. And I always like to also introduce any healthcare assistants that I'll be working with, just because I know as a nurse, I'm going to be in this bay for pretty much the majority of the day. But sometimes healthcare assistants, they're not just dedicated to one bay. Sometimes they're split across 2 bays. Sometimes they're split across the whole ward. So they may not necessarily be there in the morning to introduce themselves to their patients. So I always like to introduce myself to the patient, and I always like to tell them I'm going to be working with this healthcare assistant, I'm going to be working with so and so, just so they feel a bit more familiar. Introducing yourself is very important. I remember I had one patient who actually thought, bless him, he had learning disabilities, but he actually thought I was a policeman. So make sure, and because he thought I was a policeman, he was so scared to ask me for anything or to even say anything to me. So make sure you introduce yourself to your patients, even if it's someone that you've been caring for like the past 2 weeks, because sometimes patients can forget. You're all in uniform, you know, everyone's wearing the same thing. There's not a lot of things that they can do to kind of differentiate you from other nurses. The next thing I like to do at the start of every shift is to make sure we have certain medication in stock. Guys, this is so important. Let's just say you've got a certain antibiotic at 12 o'clock and it comes to like, I don't know, 11:30 and you want to start mixing it, and then you're like we don't have any of this medication. That is so annoying. I know that at the trust that I'm currently working at, we do have a lot of patients who are on kind of rare or unusual IV medications that you won't really see in other hospitals, especially when it comes to like certain types of antibiotics and certain types of antifungals. So it's not a case of like something like paracetamol, something like Cormoxiclav, where it's like, oh, if I don't have Cormoxiclav, I can just go next to the next ward and they have it. Or if it's paracetamol, oh, we don't have any paracetamol, oh, I'll just quickly go next door and get some. It's not a case of that. Sometimes it's a case of, if we don't have this certain medication on the ward, then guaranteed we don't have it in the hospital. So let's just say, for example, if my patient's on a certain type of medication that I know is not ready available, at the start of the shift, I'll go into the drug room, go into the fridge, wherever that medication is usually stored, and I'll make sure that there are at least 3 doses, yeah? So that's fine. And yeah, some of you guys may be like, yeah, that's cool, you've got 3 doses, that's perfectly fine. But please make sure you have more than enough. Things like vials dropping can happen. Things like vials being expired, I've never come across that. That can also happen. So make sure you have more than enough medication, especially when you're working on a Friday. Guys, please, if you're working a Friday shift and you notice that the weekend staff are not going to have enough of this medication, please just go to pharmacy and, you know, call them and say, hey, I've got enough medication for my shift. However, when the weekend staff come on or when the night staff come on, they're not going to have enough medication. Can we have a quick order? And the pharmacy will send it over to you ASAP, because there is nothing worse than a pharmacist, an on-call pharmacist, receiving a call from a nurse who's on night shift saying we don't have this medication, and the pharmacist has to leave where they are and, you know, make their way to the hospital just to provide an antibiotic that would have been available if the nurse the shift before noticed that there wasn't going to be enough of that medication over the weekend or over the night shift. So please make sure you check that you have enough medication, not just for your shift, but at least for the shift afterwards as well. Another thing that I like to do at the start of every shift is to check all the IVs. Obviously, sometimes IVs run over 10 hours, some run over 12 hours, some run over 3 hours, some over even something as little as 30 minutes. So make sure at the start of every shift, you check the IVs and you check that the IVs are running at the correct rate. This is very, very important. Don't just assume that because the IV was set up 10 hours ago by a previous nurse at 0.66 mils per hour, don't assume that it's going to remain at that rate for the next 12 hours or however long the IV was set to go. Sometimes things can happen. Sometimes a patient might press a button. Sometimes it was never set up correctly in the first place. Always make sure at the start of your shift you check the rates and make sure it's going at the right rate. This is very important as well for patients who are on IV medication that is calculated based on their weight. I know that at the trust that I work at, we take patients' weight every morning, and depending on if they're put on weight or if they've lost weight, then we have to titrate the rate of the medication in accordance with that. So always, please guys, always make sure you check the rate of your medication at the start of every shift. This was only something that I started doing when I was in this role. When I was in my previous nursing job, I never did it, just because most of the patients were on medication that was like half an hour, 60 minutes. It was very rare that I would start a shift and a patient was on like an IV that I didn't set up. But now at my new role where patients are on longer IVs, I just think it's very important. Even if your patient's just on an IV for like 30 or 60 minutes, just make sure at the start of every shift that you check the rate of the IV. Because if the IV is going at the incorrect rate and you only realize it like 3-4 hours into your shift and like the patient suffers adverse reactions, whose fault is it? Are you liable for it because you've been looking after the patient for the past 3 hours, even though you didn't actually set up the IV? Or is it the 2 nurses who signed the IV and said it was correct? Are they liable for it? Please just make sure you check the rate of your IVs. And while you're doing that as well, also just check the cannula and make sure the cannula is okay, especially if it's like an IV medication that's going to be running over a long time. Always, guys, please, this is probably the most important one. Always check the rate of your IVs at the start of every shift. Please. The next thing that I believe newly qualified nurses should try and start doing at the start of every shift is to look at any blood results and to look at any blood orders. This is very important because, believe you me, if a patient is supposed to have X blood test and X blood test hasn't been ordered, and then you're 6 hours into the shift where we actually need X blood test so we can titrate this medication, it just kind of messes up. It doesn't mess up the whole day, but it's just one of those things that have gone wrong that so easily could have not gone wrong if someone just took the time to kind of double check and make sure X had been ordered. I know that in my ward, I know at all trusts you kind of have like the basic blood test that you order, like full blood count, use these, blah blah blah. But if a patient's on a certain medication, sometimes because of the patient's condition, specific types of blood tests need to be ordered. And at the trust that I work at, normally it's the doctors that order special blood tests, but sometimes they forget, or sometimes it's been ordered for the wrong day or the wrong time, or sometimes the order is just incorrect. 9 times out of 10 is correct, but on that rare occasion it does happen where the blood order just hasn't been done or it's been requested for the wrong time of the day. just make sure you amend that. At my trust, it's all electronically, so I'll just quickly go on the electronic guide, see does this correspond with the drug chart and the timing and stuff like this, and then just go ahead and order it. That is very important. On the wards that I work at, we're very good in terms of specific blood results. If it's very important for that patient, it will be put on the handover sheet, and if the patient needs a very specific type of test, again, it will be put on a handover sheet. But there's nothing wrong with quickly checking on a program to make sure that that blood test has been ordered and it's been ordered at the correct time. If you don't do it, it can kind of mess up that patient's journey. It may mean that they're in a hospital a day longer than they would have done just because the incorrect test was ordered, or just because it wasn't ordered in general. The final thing that I believe newly qualified nurses and nurses in general should try and start doing at the start of every shift, obviously depending on your patient condition and where you work, is to make sure you check any nil by mouth signs. And if your patient needs to be fasting, make sure that they are still fasting. A lot of the times patients do remember that they're fasting, but sometimes they forget. And like with the point of making sure that the correct blood test results have been ordered, if there's ever a situation where the patient should have been fasting and they've accidentally had something to eat, that can literally be the difference between their staying hospital being 3 days or their staying hospital being 4/5 days. Please make sure you go around and make sure all the nil by mouth signs are up. And yes, even though all the nil by mouth signs are up, that may not be enough sometimes, because sometimes patients forget. Like, how many times have you said, oh, I'm not going to have any chocolate, I'm not going to have any crisps for a week, and then you see a pack of crisps and you just eat it? You know, the same thing happens to patients. Just like we're humans, the patients are also humans as well. I remember this happened to me once. The patient should have been fasting, but then the food trolley came round and then she ate, and she should have had a scan, and that was completely delayed. And because the scan would have been like at a different location, we had to rearrange transport, and it was just it was a show really, basically. It was just a whole mess. I hope you guys enjoyed this video. Thank you guys for watching, and I'll see you guys in my next video. Bye! Just glancing over and looking at the IV and making sure that there's still battery in it is not enough. Go up to the IV machine, touch the IV machine, touch the IV machine, look at it, do a quick calculation, then you should be good. Quickly glancing and looking at the IV, be like, yeah, that looks like it's on. Please, that isn't enough. You have to touch the IV. When you touch the IV, I feel like that would just kind of make you think a bit more. Touch the IV, make sure it's going at the right rate. If the patient should have had 1 litre, or if the patient should have had half a litre of this drug already, but you've noticed that the bag is still full, then you're going to be thinking,